Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How does Taltz compare to Cosentyx for psoriatic arthritis? Taltz and Cosentyx are similar in the way they work, their side effects, and their potential for interactions, but Taltz does appear to provide patients with psoriatic arthritis, PA, with more quality-adjusted life years, QALYs, compared with Cosentyx at a marginally lower cost. Cosentyx may have a quicker onset of effect. Both Taltz and Cosentyx may be used to treat adults with psoriatic arthritis, but Cosentyx is also approved for children with psoriatic arthritis over the age of 2 years. They both belong to the same class of medicines called interleukin inhibitors and work in the same way, that is to selectively bind to interleukin-17A, IL-17A, to reduce inflammation. Interleukin inhibitors are considered a breakthrough in psoriasis and psoriatic arthritis treatment because research has discovered that immune cell Th17 was a major cause of psoriasis and that interleukin-17A was the most abundant cytokine produced by Th17 cells. Side effects of Cosentyx and Taltz that are similar include infections, such as those affecting the lungs, nose, or skin, or a stuffy or runny nose. Cosentyx is more likely to cause nasopharyngitis, diarrhea, oral herpes, and urticaria, and Taltz is more likely to cause nausea and has a higher incidence of injection site reactions. Interactions with medicines such as immunosuppressants, warfarin, and live vaccines are similar with Cosentyx and Taltz. Both are injections that need to be stored in the refrigerator at 2°C to 8°C, 36°F to 46°F, before use. Both start working within a few weeks, but it may take up to 4 months for the full effects of Cosentyx to be seen and up to 6 months for the full effects of Taltz to develop. Both Taltz and Cosentyx are associated with an increased risk of developing inflammatory bowel disease. Report any symptoms such as diarrhea, abdominal pain, fever, blood in the stool, or weight loss to your doctor. Differences in effectiveness. Very few studies have directly compared Cosentyx with Taltz with regards to psoriatic arthritis. Taltz provided more quality-adjusted life years, QALYs, compared with Cosentyx to patients with psoriatic arthritis, PSA, and concomitant moderate to severe plaque psoriasis at a marginally lower cost in one study published in Pharmacoeconomics. Another study that investigated patients with psoriasis reported that Cosentyx and Taltz were both highly effective in the short and long-term treatment of psoriasis, but that Cosentyx had a more rapid onset and Taltz longer effectiveness. Other differences. Other differences between Cosentyx and Taltz include: Cosentyx is a brand, trade, name for secukinumab, and Taltz is a brand, trade, name for ixekizumab. Both are interleukin inhibitors. Cosentyx is available as a Sensoready pen and prefilled syringe, and an IV formulation that can be administered over 30 minutes by a healthcare provider. Taltz is available as the Taltz Autoinjector and the Taltz prefilled syringe. People can be taught how to self-administer the prefilled pens, syringes, and autoinjectors. Cosentyx for self-administration requires 2 injections per dose to be given because each injection is only 150 mg, and 300 mg is the usual dose. Cosentyx given by an IV infusion in your healthcare provider's office is given into a vein over approximately 30 minutes. Apart from the very first dose of Taltz, which requires 2 80 mg injections to make 160 mg, every other dose of Taltz is just 1 injection of 80 mg. The recommended dose of Cosentyx is 300 mg by subcutaneous injection at weeks 0, 1, 2, 3, and 4, followed by 300 mg every 4 weeks. The recommended dose of Taltz is 160 mg, 2 80 mg injections, at week 0, followed by 80 mg at weeks 2, 4, 6, 8, 10, and 12, then 80 mg every 4 weeks. Cosentyx should be thrown away if stored unrefrigerated for a single period of more than 4 days at room temperature, not above 30°C. Taltz can remain out of the refrigerator for up to 5 days at room temperature, not above 30 C. Natural rubber latex is contained in the removable cap of the Cosentyx Sensoready pen and the Cosentyx prefilled syringe. This may cause an allergic reaction in latex-sensitive individuals if they handle the cap. Taltz injections do not contain latex. Related questions: what does psoriasis look like? How do you get psoriasis and is it contagious? How does Tremfya work to treat plaque and psoriatic arthritis? rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.